I really struggle to sit back and allow this kind of content to be aired and distributed within the population and society without contesting it. So what I'm going to do is just do a really brief couple of minutes in trying to demonstrate how poorly managed and how ubiquitously duplicitous the governments in the Western world are. There is two theories that I have for this. Either theory number one is they are outrageously incompetent, or theory number two is that they are just acting without any true regard for the population in order to further their own careers, further their own positions, further their own financial interests. So it's one of those two things. Either they are corrupt or they're incompetent. I don't see any other possibility. So we'll get started super quick. This was published today, which is the 4th. It is the 4th of April. And it was streamed about 12 hours ago, as you can see down here, and it's President Donald Trump identifying that he is quite possibly one of the most stupid men in the world. We'll go from 33 minutes 5 seconds.
Today also the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood.
Let's pause it there for a second. Recent studies. So the 4th of April, he's saying recent studies from the CDC has identified the contagious level of this particular virus. Now, just want to go back and walk you through some information that has been dug out way before the 4th of June. So we're going all the way back to the 25th of January. And the 25th of January, there was a blog post which was put up by Dr. Eric Fiegelding, and he is, as you can see down here from his Twitter handle, a public health scientist, epidemiologist, health economist, taught for 15 years at Harvard. And he tweeted what is now over 2 months ago, so 9 weeks in total. Holy Mother of God, the new coronavirus is a 3.8 in terms of R0. That is how contagious it is. R0 is you not being able, well, there's no transmission from one to another. If you're infected, you won't give it to anyone else. 3.8 means that if you have it, you're likely to give it to around about 3.8 or 4 people. Obviously, these values can change a little bit depending on how effective you are at keeping yourself to yourself, but to give you some kind of relative talk, the flu virus has got a R0 of about 1.5. So, quote, it is a thermonuclear pandemic level bad that this coronavirus is 3.8. So he had identified in January that this was a hugely contagious disease with an R0 of 3.8, and subsequently that's been validated and verified that it is around about 3.8. Now, I'm just going to go all the way down and just highlight one point. So the conclusion is that it's got a huge R0. This is going to be a pandemic of epic proportions, and we need to be able to make these steps to make ourselves safe. And that is, don't touch your face, don't rub your eyes. Be careful whether you touch things that are contagious themselves or infected, and practice wearing masks. So not only has this guy identified that it is hugely contagious, but the only way of being able to kind of fix it is by keeping yourself to yourself, wear some masks, don't touch things. So it's not that recent evidence has just come to light. Right? Now listen to what this prick has to say about masks.
So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public...
Voluntary? So hang on a sec. It's hugely contagious. We knew this back in January. The only way of being able to contain this is by wearing masks. And now only the CDC came out in April saying, yeah, it's probably best that you wear some masks. But it's voluntary?
Health measures. So it's voluntary. You don't have to do it. They suggest it for a period of time. But this is voluntary. I don't think I'm going to be doing it.
You prick. You're going to go and kill people with that statement.
But you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard. And
I mean, that's great. And he goes on to say that it is voluntary. He mentions voluntary so many times before. I want you to listen to just one other thing before we go, and that is this whole incubation period, 12-day incubation period, right?
The transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood.
Really? This incubation period is playing a bigger role than we first understood. Well, let's go back to a paper that was produced by the British Medical Journal of Yale. And it has an author, co-author of this gentleman here, who was actually the lead researcher and founder of the original SARS virus. And this was February 9th. And it clearly identified that there was a range up to 24 days of an incubation period. This isn't new information which has been come about. We know that this incubation period has been long. That's the reason for why there is so much infection between individuals, because they don't have any symptoms. They're walking around effectively like a silent bomb. And if we also go back to another paper that was published on the 6th of February. Incubation period of the 2019 novel coronavirus. Let's just go and look at the outcomes at the bottom. Conclusions. Although we found that this distribution provided a poorer description of the data than the Weibull and the gamma distributions, it is prudent not to dismiss the possibility of incubation periods up to 14 days at this stage of the epidemic. This was on the 6th of February. We've known this information for months. Why wasn't it distributed then? Why has so many people around the world been allowed to be infected? It is either gross incompetence, gross negligence, or an overwhelming level of corruption. My thoughts on this are extensive and they're progressive, we are at the stage, or we were at the stage a couple of months ago, where we had the largest financial accumulation of wealth that the world had ever seen. The biggest financial expansion. And there was only one way in which it was going to go, and that was south. Was it coincidental that this virus, of which is trawling the earth, is an excuse to have this financial system collapsed? Take out the older population, because they're the ones that have pensions that they've put in that they're going to be taken out, that there isn't any pension money left, in which case they're non-contributory and they're taking resources from the economy, in which case bump them off. Doesn't really affect the young, because they're the ones that are going to be working for the next 50 years. Gives us a good excuse to cause an economic meltdown that we've caused over the last 25 years of incessant money printing. This is not right. And it's remaining unseen by the masses. These politicians are absolutely not doing this for their own philanthropic ideals. They're doing this for their own financial incentivization.